So now that we've reviewed how to interpret the acid-base portion of an arterial blood gas, we're going to start diving into the 4 specific conditions and what causes them and how they present. So the first one we're going to look at is respiratory acidosis. So the lab values that you're going to see in respiratory acidosis are a low pH and a high PaCO2. Now, because of the conditions associated with respiratory acidosis, it's also very likely that you're going to see some hypoxemia evidenced by a low PaO2 and low SaO2. So the number one thing that causes respiratory acidosis is retention of carbon dioxide. Remember that we breathe out carbon dioxide with every breath. So think of it like the pressure release valve on a water heater. If the pressure gets too high, it lets off the steam. Well, our lungs do the same thing. If carbon dioxide gets too high, it will release the carbon dioxide by breathing faster. So if anything causes that pressure release valve to be blocked or to not work appropriately, that carbon dioxide gets stuck inside the body. Well, the most common cause is hypoventilation. Now, this could be a low respiratory rate or shallow breathing or both. Now, less breathing means less CO2 being blown off, and so it stays in our bloodstream. Now, this happens quite frequently with any kind of overdose on sedatives or opioids. So other possible causes of CO2 retention are obstruction of the airways or anything that prevents expansion of the lungs. Now, remember, it's all about gas exchange. So anything that's going to prevent proper gas exchange could cause us to retain the carbon dioxide. So this could be things like aspiration or COPD or asthma or even bronchospasm that obstructs that flow. Or it could also be some form of lung collapse like atelectasis or even a hemo or a pneumothorax that prevents the lung from expanding all the way. All of this can cause our CO2 level to be built up in our bloodstream. And remember that CO2 is acid, so more CO2 means more acid, hence respiratory acidosis. So the number one thing that you're going to assess in a patient with respiratory acidosis is signs and symptoms of whatever caused it. So you may see decreased lung sounds if they have a pneumothorax, or a decreased level of consciousness if they had some sort of overdose of a sedative or an opioid. So just make sure that you're thoroughly assessing those things in addition to the signs of the acidosis itself. Now, that would be things like decreased level of consciousness, confusion, and commonly they get quite restless or anxious. Remember that the brain is very greedy and it's very sensitive to changes in pH or CO2 levels. The brain just cannot handle it. And so those level of consciousness changes are going to be very common. They may also have trouble breathing or a headache. Those are all signs of acidosis. Now, it's also possible with acidosis that we will see vomiting, because this is a way for our body to just get rid of excess acid. However, because this is a respiratory source, it's much less common than it is with metabolic acidosis. The lungs will just take over and breathe faster. The other things that we will see are muscle weakness and arrhythmias, and that is related to the hyperkalemia. Remember that the excess hydrogen ions outside the cell are going to attempt to switch places with the potassium inside the cell, and that can cause hyperkalemia. And so that kicking that extra potassium out into the bloodstream means that you're going to see possible signs of hyperkalemia like arrhythmias or muscle weakness or EKG changes. So you're going to see signs of the cause, signs of the acidosis, and signs of the hyperkalemia. So management of pretty much every acid-base imbalance is always going to start with fixing the cause. So we might need to protect and open up their airways. So that might mean bronchodilators or maybe some sort of artificial airway, maybe a nasotrumpet or an oral airway, whatever's required for that specific patient. It could also mean that we need to provide assistance with ventilation. Now, that could be non-invasive ventilation like BiPAP or CPAP. It could also mean invasive ventilation, like the patient needs to be intubated with an ET tube and put on a mechanical ventilator. Either way, these things are going to help to facilitate that gas exchange and control the CO2 excretion a little bit better. Now, if the patient does have any kind of drug overdose or signs of that, then we want to reverse it. So opioids get reversed with naloxone, and benzodiazepines is another common one. They get reversed with flumazenil. And if it was something other than these, make sure you refer to the pharmacist or the provider so that you know what needs to be given to reverse it. Just know what's going on with your patient. What did they receive? And make sure you're doing detailed assessments so that you know how to actually fix the problem. Priority nursing concepts for a patient with respiratory acidosis will be, of course, acid-base balance, also gas exchange and oxygenation. Remember, the whole process of exchanging carbon dioxide for oxygen occurs in the lungs. So if we aren't getting CO2 out, we probably aren't getting much oxygen in either. So let's recap. The lab values that you're going to see in a respiratory acidosis are a low pH and a high PaCO2, plus also possibly some low oxygenation levels, the PaO2 and SpO2 or SaO2. Now, common causes are things that cause retention of CO2. So the most common is some sort of hypoventilation, airway obstruction, lung collapse. So when you assess your patient, you're going to see signs of one of these causes, and you're going to see signs of the acidosis, which might be things like decreased LOC, possibly even vomiting, and you might see some issues from the hyperkalemia like arrhythmias. To manage respiratory acidosis, our number one priority is to support their ventilation and oxygenation and to identify and treat the cause. Now, remember, providing supplemental oxygen to someone who is not breathing correctly or doesn't have a good airway is not beneficial. Make sure that their airway is open and that they are breathing before you apply oxygen. Now, everyone's argument is, well, applying oxygen only takes 5 seconds. Yes, in the real world, it only takes 5 seconds to apply oxygen. However, it also only takes 5 seconds to apply an EKG lead, but that's not going to help your patient. It's not always about how quickly you can do something, but about the impact that you're actually going to have. So make sure that your patient's airway and breathing are taken care of first, please. So that's it for respiratory acidosis. I have attached the ARDS case study to this lesson because it is a classic example of respiratory acidosis. So make sure you check that out, as well as all of the other resources attached to this lesson, and that you check out the next 3 lessons to learn about the other acid-base imbalances too. Now go out and be your best selves today, guys. And as always, happy nursing.